Yeah, so it's just been, so like today, that 1/8 milligram tablet. Yeah, I was gonna mention, okay, many times on the record that we've been keeping of my blood pressure, I've had spikes of 200. I had 200, over 200 for an hour at one time, and then the nurses are telling me go into the hospital. But I'm not going to fare well on that trip, and I know what they're going to do already. I know that they're going to increase by a dramatic amount the amount of morphine or hydromorphine I'm taking, or something powerful like that, just to get me through the moment, and then I'm going to be sent home with nothing, and that and worse pain. So at this point, I'm looking for alternatives, and I wanted to speak to you. Just that's a state of affairs. With I'm just taking Tylenol, and like today I haven't taken any of the hydromorph. Last night I took like probably around midnight, two of the 1/8 milligram portions, and then yesterday maybe at 6 p.m. It usually coincides with when I take the gabapentin. The worst times of day are the hour before and the hour after taking the gabapentin. And then I have a brief period when it's okay. It's more like 2 hours before, honestly. And I've had to just I was taking like the hydromorph, and then I don't know if I want. I don't know what I want to do about that. If I would just want to give into it and take it until it stops working, and then suffer briefly, and then that's the end of it, or if I'm suffering all the time like I am now, I don't know. Maybe if I bridge through it, I'll become so immune to pain. But it's not even that. Even if I do with my mind, uh, get moving is a whole nother ball game. It's becoming more and more difficult for the caregivers to manage that. Moving me at night and during the day, and getting me into positions and moving me out of positions, and leaving me alone is becoming a danger, you know. And honestly, if it comes down to my mortality, I'd much rather be here than in the hospital. But I pray every day. I'm almost praying constantly and doing some kind of like spiritual uh, internal, quest. Um, and that's why I can sit here and talk to you with a really like a peaceful mood about me. But what I'm going to do now is just I'm going to go on YouTube and just tell my story. I already have a channel, and I'm just going to tell my story and tell what I've been through. I don't maybe some and I mentioned to your message, or I sent an email. You read that, right?
I did, yeah.
Yeah.
I did.
So go ahead.
Oh, yeah, no, no, no. You can finish.
I was just going to say, so I'm resharing some of the content from the email with you now. Um, but like one of the things was that medicine that I just spoke with my mom like an hour ago, and they sent it on Monday, registered mail from Portland. So
Okay,
it says it arrived in Canada today, uh, at the
okay.
post, or yesterday at the post depot. So I expect to receive it by Wednesday, and it has a series of instructions. She said it was in these little, like, almost like pellet type of things, these little small little pellets, and I'm supposed to dissolve them on the tip of my tongue, because apparently there's some nerve receptors in the tip of your tongue that are much more conducive to nerve uh, activation or something to that effect. Um, and then I'm supposed to dissolve that on there. Two of them, I think, 3 times a day, and one other one that I'm supposed to take once a week. Um, and then after like 3 weeks, I should see a marked improvement. Um, and it's regardless of the gabapentin. It's not a that's not a a concern. So this is apparently I didn't ask my mom more at the time. I guess I'll ask her another time. She said something about the doctor there saying that this was a treatment that they used on that she had routinely used for people with spinal cord injury. This is some retreat that she went to in the south of India for the last like month.
Do you know what is in the compound? Like what is the?
Well, I'm gonna have it in hand soon, so then I can share with you the name and various whatever.
That would be helpful for us to know because
Absolutely.
rarely some of those herbal compounds will react with, what's
I know.
It's just helpful for us to know it so we can kind of try and cross-check that.
Absolutely.
Okay,
Absolutely.
but yeah, it's a tough thing, Nirmala. I was also reviewing Dr. Krasnikov's last notes. He had prescribed or tried to prescribe this special compounded cream to use with a couple of different agents in it. But coverage of her is a tricky thing. Were you able to?
That stuff did you read? I mean, he described to me that you better not get it near your pet. You better wipe it off when you're done, wash it off, otherwise it's gonna do some kind of scarring on your skin. The stuff came with a whole caveat of dangers, and
I don't think that's necessarily true. Or if he did tell you that, like he didn't document any of that. And these are like one of the things in it is gabapentin. The other one is lidocaine.
okay,
The other thing is ketamine.
I see.
Amitriptyline topically.
I see.
I'm sure it's not great if you're like if you had a pet that licked
Oh,
that.
okay,
I'm
okay.
sure that's not great for them.
No, that wouldn't be great for them. No.
But topically on your own skin, I feel like that. I don't think you need to wipe it off because that would kind of dilute the point of it. But I would give it a try just to see because it's, what's nice about it is you're not going to get systemic side effects. It's not something you're ingesting, so it's not going through your entire bloodstream. It's not going to your brain. It's just hitting the nerves at the level of the skin. But my concern with it, and Dr. Krasnikov kind of anticipated this as well, but it's probably costly because it's 4 different medications, especially compounded into the cream.
Yeah, well then it's out of the question for me. So, yeah, there is that. And
Yeah.
what were you gonna say? But
Oh, I was just gonna ask if you can just check with your pharmacy, roughly how much it costs.
yeah, I'll check. And the gabapentin, I have to. Okay, let me look at my things that I wanted to talk to you about. Diet. What I've discovered. Okay, there's a video that I watched on YouTube. It was a doctor with MS, and she's in Iowa, I think. She's doing a whole research project into several different, sort of debilitating sicknesses or whatever you want to, like Alzheimer's and MLS and other things like that. What the symptoms, she has MS, she described were very similar to what I experienced, very similar in her skin and the muscles and the sensations, and it basically debilitated her to the point where she was just stuck in a chair, couldn't practice, she was a teacher, and and then she talks about how she went through all kinds of research and tried to find, and she talks about how she came to, now she's practicing again and she's getting around, she has no problem with her hands and everything, but it all came about because of her diet. She made cut out certain foods and add certain foods, and I can see really an effect of that. I'm going to try that as well, and I wanted to know if I could get help with that. And I did ask for a dietitian. It was very rudimentary. Certainly wasn't what I would expect from a dietitian if I was paying money and they were working for me and they were offering help to me. It was more like, okay, just eat like this, that, and this and that, and it'll help you with this and that. Okay. You know, it was like that. It wasn't like any follow up or recommendations of food or a dietary plan or anything like that, which would be very helpful. I don't know if there's anything like that available, but that would be extremely helpful. And the,
Yeah, yeah. I think, I'm not sure.
is it just like basic, like basically, you know, yeah, is that available? Sorry, I cut you off.
I'm just not sure if, like, with regards of treating your condition, treating your pain with a specific diet, I don't think there's any harm in trying to pursue that. I just don't think there's a lot of, like, evidence, like, research to
Well, that's what she's
support
doing
that.
to prove it. And it's
Well,
something
but
that's worth looking
no,
into.
sure, but there's not really like empiric evidence for like a dietitian to kind of go off of and say, oh, okay, I've seen this before. I've like, worked with
Well,
people.
for instance, proteins. What are the
Yeah,
effects of proteins on on the nervous system and on nerve pain and on the transmission of signals within the nerves? They have a pretty large effect, right? When you say so, and
no, I
if
don't
there's
know that.
you don't know that. Okay,
No,
I would think
there's
that's
no
in
evidence to
this
show that that has a correlation.
really okay. That's what
But
she's
I mean, I
researching.
think in people's situations where they have tried the standard things that Western medicine has to offer that hasn't been as helpful or that hasn't worked for them, I'm certainly supportive of trying
Well,
alternative things. But I think
where does it leave me? Does it leave me with like throwing gabapentin darts at a dartboard and like missing like all the time but continuing to do the same thing because that's the only thing that we know? Is it, or is it like, okay, we're doing research. Let me try to see what the latest research is on the subject and see if there's some alternative research that may be going on that leads to an actual solution for people, for my patient, for instance, or our patients, for instance. Like, is it all just come down to we throw our hands up at this? We have no answer for this, and you are, I'm keeping records of all this stuff with my writing down, my bowel care and the pill times,
yeah,
um,
yeah,
yeah, my blood pressure readings, and that's all I'm saying is like I want some help with understanding what's going on, and uh, other than and Dr. Krasyakov, um, this is pretty much what he told me is that, and I hate to even repeat it because it's so it just it's almost cold, coming from the regent doctor on this kind of subject matter, just to say what I just said, to repeat it again, there's really nothing he has to offer me, and that's okay with him. It's just okay, and talk to you later. Call me in a month, and we'll see what we have to say. Meanwhile, it doesn't matter what happens to me in that month. It's just a check-in. I could go downhill or uphill. I'm obviously going downhill on my trajectory. So likelihood is in a month, uh, it's unless we do some changes, unless we look at something different, and I can't conceive it. Maybe I'm the only patient that's ever had this experience with gabapentin. I highly doubt it. So this must be an experience that's been shared with doctors, especially people at high level, or maybe that's a terrible assumption for me to make, that this is only a one-off situation with my reaction to
no,
these.
I don't think so. I think Ramola, you've been given the option to reduce your dose of gabapentin and have not been able to do that. And it's simply a matter of you take the pill or you don't. So if you want to reduce your dose, that's in your hands. You reduce the dose and see how you do, but you gotta stick with it for a while to see how it goes. And if you're not able to do it, well, then you try, and that's just off the table. So I think the choice has been given to you.
Yes, but taking
I
them
support
does
it.
not do me any any good. And I've tried. And what he said is, okay, if you need to take it to increase it by 100 at midnight. I've tried that. It gets worse. Trust me, it gets worse. It's all documented. The blood pressure, and then I can't go back down again. I'm stuck at
Yeah.
that because I suffer more throughout the day. I suffer more in the later doses and the daily doses. Now I'm left with suffering more if I try to cut down. And forgive me for saying this, but you and Dr. Krasikov repeat the same thing to me, and it's the same thing that I've heard before, which is that just throw these dartboards that miss all the time. You know, like take more gabapentin, take more of this. Pharmaceuticals, as if pharmaceuticals are the answer to everything, and diet has nothing to do with it. No, diet, and I know you're not saying that, but what you are saying is it's unproven science, and that's just as much as saying that to me. It's like go at your own
Yeah.
and figure it out on your own, and how am I supposed to do that? That's what I get. That's what I'm looking to my medical professionals for.
I mean, I am willing to look into it to some extent, but my entire training, my entire framework is a very different one than one that is centered around diet or more naturopathic means of care. And that is the honest truth. That is not
Okay.
my realm of expertise.
Okay. Well,
That is
if
not
this
it's
patient,
not what my educational background is in. So I'm all for you pursuing that, but yes, there are other specialists for whom that is the framework of their training, and I would support you in trying to do that, but that's who you need to be working with. I'm not that person. You know,
I
I'm a
see.
Western medical doctor who comes from a framework of Western medicine. And diet is a part of that, but it's not the central part of it. And how we evaluate the efficacy of a dietary change is still within the Western medical framework. And unfortunately, like I'm a little bit stuck in that because
okay.
I don't know
So
any other way of evaluating that.
here's us.
While I think it's,
Uh,
while I think trying to change your diet might be important and might be helpful, I don't really have a way of being able to guide you of, okay, Nirmala, you should try this or that, or not try this or that. I just don't know.
What I was trying to ask is if I could share a video with you, and you could actually look at it and tell me uh, what you think of the science that's mentioned in the video, or the study that's being undertaken, or the multiple studies that are being undertaken within these realms of nerve pain and understanding nerve pain, and gaining knowledge within that field of information of what's going on in the body, that, or just throwing people's hands up to gabapentin or nothing, or it's within the
Yeah.
realms of these particular medical pills, and if none of them stick, or if they cause a person to slowly die, then that at least we've given it our best shot. That's what it feels like everybody is saying to me.
Yeah, I would accept, I would look at a YouTube video. I would maybe read a few papers. I'm not committing to doing an extensive literature review. I honestly cannot commit to that in terms of my own capacity.
Right,
But
right.
I'm willing to have a look and, to the best of my ability, try and parse through what I really feel about it and how strong I think that evidence is. Knowing that, okay, I am open to my mind being changed. I'm open to the research that is out there saying that yes, this is significant. This has impact. The studies are rigorously done in a way that I find proper, or in a way that I've been trained is proper. And I'm also open to the idea that I may look at this evidence and determine that it is not of high quality, that it is not reproducible, and that it is not significant in the way that Western medicine evaluates things. But if you are okay with that, I will have a look at it.
Sure,
Do
sure.
the best that I'm able to, and again, within reason. Like I cannot undertake or agree to undertake an extensive literature review of this, but I will watch,
Okay.
a couple of YouTube videos if you send them to me.
Just
I will
one video. Tell me what you think about this video. Yeah, and this
You sent a
person.
link. You sent a link in your email.
I did.
The
That's right.
YouTube link. Is it that one?
It's one of those. Yeah. Or did I only send one? It might
You
be.
sent just the one.
Okay, that's the one.
Miracle
It's kind of halfway through the video where she actually talks about foods, but all before that is just about what she went through, how she came to the conclusion that this was what she needed to do, and made those
Yeah.
decisions.
Okay.
Yeah.
I will watch that video for sure, Nirmala, and then
Okay.
we can discuss it next time as well.
Yeah.
And
In the
is it okay with
meantime,
you? Yeah. No,
in
go
the
on.
in the meantime, one of the things I had discussed with you when I went there. Oh, there's one other thing regarding medications. Ket Ketonov or Ketorolac.
Mm.
That one. Can I try it?
So
If not, what's the
ketorolac is an anti-inflammatory medication.
correct?
It can be used sparingly, but it is only available in injection form. So
Oh, really?
someone would have to inject you. Yeah, it's not an oral medication. So it
And
is
how
used
long do
sometimes.
you use it for?
Uh, it's like it's a pretty strong drug, so it can cause internal bleeding, like stomach bleeding.
What
So when you
about
use it
Ketonov?
sparingly, ketanol.
Yes,
I'm not familiar with that.
it's an oral form, I guess.
Uh,
And
it's sometimes called Toradol here.
Toradol.
And it's used, max, 3 to 5 days
At a time?
at a time.
Really? Okay.
I mean, I'm looking at it again. I'm most familiar with it being used in IV or intramuscular form.
Wow.
It does apparently come in an oral form. I'm not sure if that is here in Canada or if it's the United States. But
Europe. It's definitely in Europe.
yeah, it's similar. If you were to take it orally, it is
Mhm.
similar to say taking Advil or naproxen. It's the same class of medicine.
That's stronger.
But yeah, so I would say if you did take it orally, you cannot take any other medications in that class. So
Yeah.
I can ask our pharmacist about that if it's available here, and also
Okay.
what coverage. That's the other question.
Okay.
But I will look into that. So I'll ask our pharmacist about that. I wanted to just
And
ask you, so going back to your autonomic dysreflexia, so the elevated blood pressure readings for over an hour,
yeah.
do you ever get other symptoms associated with that, like chest pain, shortness of breath, blurry vision, headache?
And all of that. The pain level goes beyond. It's like 20 out of 10. Huh? It's and it's getting worse. And then I don't know. Like it. Yeah. My. That's what I'm saying. Some of these hearing issues that I'm having now remind me very much of what my brain goes through when I go through those episodes. So it could be very well be damaging my hearing or doing having some effect on it. That the sound becomes very very strong in my ears of my blood, and I can hear my pulse rate go up. It's gone up to 130, which my normal, it's gone even higher than that. I can't remember what the record, what the highest it's gone, and I've had to take lorazepam, but that I just pinch at it too, take a very small amount until I absolutely have to stop, till it goes down. That was what happened with that hour, and take, yeah, and it's just, but this gabapentin has put my nervous system through ultimate
Yeah.
suffering, and I'm going to document it. So it is what it is. It is what it is. I can't go through it alone anymore without any answers at all, and with the only answers being repeated to me, which I don't know how to deal. I don't know. There's no like appropriate response to those answers other than it doesn't. I don't know what to say. That's like kind of the only
Yeah.
response, and both
Yeah.
the doctors and the patient, and So where we go from there is yeah, is just
Yeah, I think I I think there's a line there with the blood pressure and the heart rate. So there are medications. So this is very common in high spinal cord injuries. This can happen because the spinal cord stops talking to the control centers of the brain that control our heart rate and our blood pressure and all of these things, or the connection is a bit patchy, let's say. So this can, however, be quite dangerous. So like a sustained blood pressure of over 200 for more than an hour is a very dangerous thing because it puts you at risk
I
of
know,
like
I know,
stroke or heart attack, right?
I know.
So it is very important that if you are not able to get your blood pressure down, within an hour, that you actually go to the hospital to have them manage it and bring your blood pressure down. Unless the pain adjustment, like the pain is probably contributing here, but
It
the
is.
like
It's absolutely contributing. It's the
but it's not the
number one
only thing. It
factor.
is it's largely
Yeah.
caused by the spinal cord damage itself, but it's imperative that it's treated properly. So there are some medications that I can prescribe you to drop your blood pressure short term down, a little bit. But if those don't work, I do just want you to know, Nirmala, we need to go to the hospital. And if you feel like you can't get yourself there, it's really reasonable to call an ambulance to come and help transport you there.
I don't want to die in the hospital. That's it. Period. I'd rather go
I
at
guess,
home.
well, I guess it's the
Like
risk
I,
is you don't die. The risk is you have a stroke and you're like further disabled from that, but you live.
yeah.
So, I think again, I can't force you to do that, but I'm recommending, especially if you have associated symptoms, like if your blood pressure is that high, and you're having chest pain or headaches or changes to your vision or hearing, it is really important that that gets dealt with quickly. And I would, if that was happening to you and you were here in the clinic, we'd send you by an ambulance. We'd call
Of
911
course you
and
would. I
send
would
you,
hope that
right?
you would. Absolutely.
Yeah,
But here I'm
yeah,
at home. I've been to the hospital many times, and I know what it is like. They put me on a mattress that hurts my skin, and then I get left in there for hours in order for me to deal with the pain. They give me a high level of pain medicine. My skin right now, my skin is completely healed up. I get bandaged regularly. They wouldn't bandage me. They wouldn't know how to bandage my bum. They wouldn't know. They wouldn't position me in the mattress. They wouldn't. Honestly, they would give me not bless your heart and bless everybody's heart that's in the line of medicine, including the nurses. But they wouldn't know how to deal with my situation, and they would, like I said, I would be in there and I would just yeah, I would they might prevent a stroke, but I would end up being a vegetable there. I don't think I would ever leave the hospital from that point
yeah.
on.
I understand that
I've been there many times.
situation.
I've
Yeah,
experienced it. I know.
it,
I know from experience. I end up in the lower level, the emergency, for a few days because they're always trying to find a bed for me. This time, one thing good is I have a spare air mattress that I would bring along with me, so I'm a bit prepared. I have it packed, and so I would be able to take care of the mattress problem, and they wouldn't have to look for. Always when I get there, the first like 4 hour delay comes when they're trying to find a mattress, even in the waiting area inside. So then I'm sitting there in pain, and nobody really
yeah,
is paying attention to me. They don't at this point. They don't take my pain seriously because I can tolerate high blood till it gets really high. Even one time I was in there with over 200 blood pressure, and I was telling the nurse, "Hey, it's over 200." They were looking at me like, "Yeah, right. You've been sitting here for an hour. What? How could that be?" And then I said, "Just please go ahead and take it." They wouldn't even want to take it. They went ahead and took it. Oh, and they started taking it a little more seriously. But yeah, I've experienced things there, and then when they get me on the bed, I'm in an unusual situation because I've been through this so many times.
yeah,
The skin, and all quadriplegics tell me that. All spinal cord injuries tell me though, you lose a lot when you go in the hospital, because then they're very busy. They have to see other patients on the ward, all the nurses. So you become one amongst many. Nobody's familiar with your care at that point. So you can I can bring my caregivers for time. No, I'm just sharing with you the truth of
Yeah,
the
no,
risks that I have from going in there.
I can hear that, and I can appreciate that happened, and I wish that it didn't, but I believe you that it does.
Hmm.
And it's a hard thing, right? Like, again, you get to make that call for yourself whether you go or not.
Right,
As long
right,
as you understand, you're obviously weighing the risks and benefits.
right.
And that's really my job, is to like make sure that you have the information you need to make those decisions for yourself. In the short term, sort of as a temporizing measure, because this has been happening, I do think it's reasonable for me to prescribe you something just as needed. So it's not something I would have you take every day, but hydralazine is a short acting and quick acting medication to help drop a person's blood
Is
pressure.
it oral or
It's
inhaler or
it's
what?
an oral medication. It's an oral medication. It might take us some time to find the right dose, but um,
Because they had given
right
me
now,
Captopril, and I will not touch that stuff. It's
okay.
killer, killer, killer. Even I didn't want to take it. You know why? Because what happened, and I knew it was going to happen. Because when I take the Hydromorph, if I took it now, my blood pressure, even though I'm talking to you and I feel like it could go up, is probably around 70/50 or something like that. That's what it hovers at when I'm in a lot of pain, and then the pain just gets so great that it shoots up, right?
Yeah.
Yeah, and but if I take the Captopril, the Lorazepam, the Hydromorph, even in those minor doses, the three of them together would tank my blood pressure when it dropped. And I've done the Captopril and I've been stuck for like 24 hours, just barely getting enough to breathe, right? From that one little piece, a tiny, and I take such a small amount, even of the Captopril, that I'm taking a huge risk taking that, because my blood pressure, even that whole time, it could have dropped any time. Like, I'm just waiting for it to drop, right? I'm just waiting. I'm sitting there shaking, waiting. My caregiver is getting me whatever I need. I'm waiting for it to drop, and then it drops. I'm like, okay, we can breathe now. We can relax, and then, this is when I get to bed. Not, and then if I by that time I may have taken half of a milligram of lorazepam and like half a milligram of hydromorph, a little even more if I've had one of those episodes, and then usually happens because I was not in the right position in the chair exactly, or there was a wrinkle somewhere, or the bladder infection. That was a really bad week for all that stuff, and then but that's all done now, and I'm okay. I mean, past that, but I'm still like the pain is more than it was then. But the BP episode didn't go up to that level again. But then I'll get it, I will get it down. But that time it will go way down, right? Especially so if I take a heavy med like Captopril, it'll be the pain will go up and I'll go down and it'll be down for so long. And it's not a like right now it's down, but I feel like I can speak and I ate something and so on. But uh, if it stays down in that manner from the pill, I can't get it up. There's nothing I can do to get it up. I can struggle
Right.
and struggle.
So, I don't know what that leaves you with, because I hear you there, Nirmala, but, uh, you know,
Well, the
I think
temporary, the short-term one sounds better at least. I mean, the
yeah,
Captopril
I
lasts
think
for a long time.
hydralazine is something that I think is maybe reasonable to try,
Yeah.
again. It's short acting.
Is there a nasal
But
thing that like a spray?
no, it's a pill, unfortunately.
No, I mean, is there one?
Is there one? I don't think so. I think it only comes in pill and IV form.
Okay.
Uh,
Yeah.
yeah, no, unfortunately.
That's right.
increasing the heart rate.
Yeah, all those pills do
Now
that
that's
to me.
where it can happen. It can also cause flushing. It can
Yep,
cause
yep, yep,
um, palpitations.
yep.
Now the real rare one, but also really important to know about is it can cause chest pain
Yep,
or even slow blood flow to the heart. So
yep.
if you take this medication and then you develop chest pain, then you really do have to go to the hospital.
Okay.
Then they gotta rule that out. But that doesn't happen very often. And it's a bit of a
Oh, I don't
balancing
know if
act,
I'm
right? Because
conveying myself to you correctly.
no, I think you are, but I'm just telling you the risks, right? Like
Yeah,
again, I think I have to give you this information so you can
yeah, yeah.
decide. But if your decision is no, I don't want any treatment for this, then that's your choice. But it's my job to tell you,
I know, I know.
a risk, a small risk, but it's a risk, and it's balancing the risks of having severe autonomic dyslexia and the things that we talked about before, right? But I hear you. It's not. It's a scary kind of decision to have to make. So you don't have to decide right now. I think if you want to think about it,
Think about what? Whether to prescribe it or not? Or whether to.
yeah, whether you want to try it.
Well, if I don't have to pay for it, I might as well have it on hand as one of my options if I
Okay.
get to that point. Like
Okay.
I don't know. I don't know whether I would just go like I know when I take the current like different medications I just told you about, which is the gabapentin, the lorazepam, and the hydromorph in the doses I told you. The the gabapentin I have gotten the 600 in the chop and I chop it, but I can take a smaller dose if I need if I need and I have in that situation it didn't really you know make that difference, but I'm struggling. I'm praying a lot. I know that modern science doesn't really account for that either, but yeah, there's a lot of things that I'm finding wanting in the modern science as of yet. Like maybe in the future, I think that things will open up in different uh, fields that need to be looked at. Like instead of just, it seems like an area of science that's either being ignored by research or has not found research hasn't found anything like meaningful yet, and it's just or one of the two, a combination of the two, some combination of the two. Uh,
Right.
do you know what I mean? Because like to either talking to you or talking to him, which are the two, uh, you know, people in the field that I have contact with, who should be able to gather information within that realm that I could help me. I don't. I'm not. I'm getting what we just talked about. That's pretty much where we're getting at, and both of us kind of concur that the emergency room is my best option at this point to prevent a stroke. Like that's not a very good conclusion to reach for anybody. So I
Yeah.
yeah, like or stay at home and take the. I like my life here. I mean, I have awesome caregivers. I have a good schedule. My skin is healed up. My bowel and bladder are functioning correctly and well. For some reason, I'm struggling with this nervous system, uh, you know,
Mm.
foul up. Trying to describe it in friendly and not so bad terms. But
Yeah.
yeah, so I just putting myself through that, or it's going through that, and
Yeah. Okay. Well, maybe I'll send a prescription to your pharmacy just for a small quantity, and you hang on to that. Should you wish to try that, see if you have real spike in your blood pressure that's lasting. If you take your blood pressure a few times, like 20 minutes, and it's still above 180, okay, I want you to try it. Let me start you with
absolutely.
Okay. How about, so I think my next appointment is in April sometime, but let me just get my schedule.
Yeah.
Okay, why don't we chat on the 16th of April in the afternoon?
Okay.
Is that okay? How about 4 o'clock?
4 o'clock. Yeah. So on the 16th of April.
Yeah.
So that's 2 months from now.
Yeah.
That was another thing that I really wanted to talk to you about, and I started to about half an hour ago, which was that when I spoke with you, you assured me that I would be able to get, medical advice like really quickly if I needed to. I haven't been able to get in touch with you or a doctor very easily, and I have left message like 2 or 3 weeks ago. I left a message with regards to what we just talked about with the nurse, and this was the soonest that they could put me in touch with you. So it's not a very urgent response. Is that the best I can expect, or?
I think the nurse who spoke to you about the autonomic stuff, she did advise you to go to the hospital because
Yeah.
she talked to me, and that's what I advised her to tell you.
Okay.
So, as far as I'm
No, I meant about the
concerned,
further about the medicines and things like that. The medicine.
yeah,
Yeah.
so all of those kinds of things, well, unfortunately, yes, my booking time is about 2 months between appointments.
Yeah,
So that
yeah, I
tends to
see
be,
that. But there should be other medical professionals. That's what you had told me, that there were other medical professionals on staff, like doctors, and that I could make an appointment with
but
one of those if I had
really
to.
only if it is deemed necessary. So, like, if there is a new issue
Okay.
or
Okay, fair enough.
urgent issue, then yeah, then you talk to a nurse first. The nurse triages things. They talk to the doctor for day, whether that's myself or one of my colleagues, and then it's determined, how urgently you need to see based on what you're saying, and whether or not we are the right people that you need to be talking to. Sometimes we'll say like, no, our advice is you need to go to the hospital or care or what have you. But on other occasions you called and you had your diagnosis and you made a bit of a plan for that. Unfortunately, we didn't get to talk very much about that today. We'll have to talk
No,
about
that's okay. That's okay. I haven't had one of those in over, I think, a year or two. So
Yeah.
I'm very careful too. I have
Yeah.
made some measures.
But if that happens, say you do get severe nurse, that's the kind of thing to call about. Speak to a
Yeah,
nurse, and then the clinician of the day will get back to you
yeah,
with
yeah.
a plan.
No, I was very happy with the response over that. I was very happy. It was very reassuring. Everything was done very quickly. No, that was not a problem. No, no.
Okay.
Yeah, I'm not complaining at all
Very good.
about
Well,
that.
thank you for your time today. I will speak to you in April about the and then I will have a look at that video you sent over at the office.
And I'll keep you up to date on if anything I get results from this medicine, and I'll let you know right away what it is. Oh yeah, I'll let you know first right away. I'll send over information about what it is. I'll try to wait for a response from the nurse or from you about what it might be or do.
Okay.
Yeah,
That would be great.
yeah, yeah.
Okay. All right.
Okay.
Well, thanks so much.
Okay,
Take care.
okay. You too. Have a good day. Bye bye.
You too. Bye-bye.
I tried to cover all the bases there. I hope I did okay. That was 44:44. So he must have had a clocker on. Oh, that's my life, guys. That's my life in a nutshell. I'm gonna say goodbye to Vlad before he moves. finished our appointment.
Yeah.
Did you think I was clear?
Yeah.
Not much.
And,
about
yeah, but is of course it seems the old school just about.
very old school.
Yeah, that's why he is not in the loop. That's influence of protein and fat acid, short and middle chain acids, fat acids, in the metabolism inside nerve system and conducting in the nerve system. This is actually new stuff. When I was a student, we didn't learn about that too.
Right.
I learned it
It
and
kind
I
of
knew
is a little
people.
slow, I guess.
I surprised that actually because I learned that stuff pretty deep because I did my research when I complete my PhD research according to that. And every year it's new knowledge, open.
Right.
It was end of 90s and beginning of next century. So at that moment, it's I already was
He wasn't
16.
even really willing to. He's gonna watch the video, but
Uh-huh.
it didn't seem that open or
Well,
receptive.
yeah, that sounds like it's like hundreds of patients ask him to do that. What's
Yeah.
wrong with you? Just,
Yeah.
it's, your patient did work instead you searching information and digesting
If
that
I were a
information.
doctor, I would be wanting to help my patient so much so that I would be eager to find a way that would improve his condition.
Yeah,
Like,
yeah, that's just estimate information and
Just try
say,
it,
oh,
yeah.
I can't understand because I need extra
That's right.
information to build up some my
Something
understanding.
positive, yes.
Yeah, and
I hope you
maybe
can
we can
maybe-
find someone else.
Yeah. That would be a good solution too, yes.
Yeah, what I did, that's because I was overwhelmed as well. But
Yeah.
anyway, I wasn't familiar with internet before I came in Canada. I knew what is internet, but I didn't have time to do that research. Ask my relatives of my patients if something narrow thing
That's
that
right,
they did
yeah,
not
yeah.
know just. They offered their help, so of course to that just if you can print me on the print it out or just copy me on the diskette that we had diskette that time.
Yeah, for sure.
And also, yeah, I was surprised that Canada was behind even teacher of mine who is from Russia as well, but she immigrated here in 90s, long time ago. So he's a translator, she's translator, and she's suffering with gut issues. And so ask her, do just microbiology research. Ask your family. Oh, they don't believe that. How? That's whole Europe, whole USA do that. Did that. They built the treatment, pneumonia, the treatment on according to that, what's going inside the intestine. The surgeon treat the chronic furuncles. Just the first step is research what's going inside with microbes inside gut. Change diet, sterilize the intestine, put new microbes. Canadian medical system doesn't believe in that. Oh my God, that's how we found it's already a proved fact 200 years ago that without microorganism the digesting doesn't happen in our body. Ton of vitamins we receive from microorganisms
How
from our
do pills
body.
go in your body?
Yeah.
They operate with the enzymes in your
Yeah,
stomach.
the proteins, the albumin is the main carrier in our blood that carries everything, vitamin, medicine. If albumin low, no medication will be work
There you go.
because we don't have carrier. The suitcase cannot be transferred from your trunk
Right.
to the train because there is no carrier.
Yeah.
So you need carrier to transfer that.
And it makes sense that for food it would operate the
Yeah.
same way.
Proteins, this is the pump between intercell space and blood flow or intercell space. It transports all things, all minerals. Transport all substance from through B-lipid
That's why when I was
form.
talking to him, I was thinking, if I share this, like if as a recording, if I share this, I would be embarrassed. And then I'm thinking now, no, he's proud to believe like this. This is what he trained in medical science. There's no connection between proteins, or he doesn't know of it. He's not aware, or not even just proteins, food in general. Between food, the quality of food. So at home, what does he just eat anything off the shelf? Like he just buys snack food for his kids? Does he
You
just
can get McDonald's.
yeah, just eat McDonald's if
Yeah,
you shit around.
and they eat that overfried food, just that
Yeah, just
damage everything.
Very, whatever you
Yeah.
want to eat, just eat
Even
it.
it's already proven. Who American? I don't remember who. It's long time ago. It was 15 or 20 years ago. We were arguing to discuss that situation in our in my department, as between doctors. When we drank, so after job, we just we discussed the new researches, and just Americans, I remember, nutritionists, they discovered that that over fried food from McDonald's, it's damaged the peripheral nerve. The
you go.
yeah, because the peroxide, the lipids with free radical lipids that result of frying is they damage not only nerve, actually they damage the lungs as well. Just it's what's happened when polytrauma, when broken several bones. What
Yeah.
happens? The lipids cannot be oxidized properly because during stress, not only trauma and all general stress, psychological stress, that chain breaks, and the exchanging between lungs, between blood and air, get worse. It's one cause of post-traumatic pneumonia, and after car crash, smash, several bones broken. So, and they discovered that its conduction in the, it became converted in the wrong way, that leads the decreased tensions and make its wrong sensations on the peripheral nerve system with peripheral receptors. Also, it's they proved that it's changed transmission between centers in the brain before they get in the analysis of the pain in our
That makes
cortex.
a huge difference,
Yeah, just and I don't know, just and
If
I
it's true,
hear
yeah,
yeah.
you didn't follow up
Hopefully, yeah, just I'm my family doctor. He's Iranian. He's young, and he just like
that. See,
him,
that's the kind
in
of doctor
him and one page.
I would love to have him as
Yeah.
well. I know the kind of doctor you're thinking of, yeah.
He's in Surrey, so
Surrey, really?
Yeah, he was.
Not that
He
far.
began his practice in Spring Medical Care Center, that it was newly opened 2018. Just yeah, I moved from Burnaby from here to Burnaby 2017, and that yeah, I noticed that my blood pressure hurts me, so I start looking for doctor, family doctor, and he was not newcomers, just new practicing doctor, and unfortunately he moved from Burnaby to Surrey, just on the border between Surrey and Langley. It's very far away.
Can you throw that purple cloth on my waist just to fold it up small enough?
On your waist?
Yeah, just
Ah,
cover it.
mm.
Can you fold it smaller? Yeah. Hey, Carla, you want a blanket? Alright,
Okay.
thank you so much.
So have a good day.
Have a
Do you
good
feel
day.
better now?
I just feel better from talking, but
Mostly that. No, this is a big deal as
it's a
well.
cookie too. Can I have one of those?
Yeah.
They're actually pretty good, and they're unsweetened. So we ran out of sugar, so that was a limiting factor.
Yeah, sugar is interfere on lipids metabolism as well.
That's right. He wouldn't have, hey, Don, package? Oh, that's probably it. That's it, yeah, there you go, you get to see the medicine. That's it right there. Okay, well, I'll let you know.
Okay.
See you later.
It's Tuesday.
Friday. Friday. Wow. Dad. Oh boy. You missed a really wonderful conversation with my doctor. I'm joking.
This doctor?
Well, actually, it was a good conversation with this doctor. Very good. After the original doctor conversation, then I was being a little sarcastic, a little bit, just a slightly. Or maybe not sarcastic, but
What?
maybe it wasn't sarcastic, but I don't know. I wasn't being completely honest.
The conversation, you're saying the conversation?
I had two conversations.
Yeah, let me see if I got it right. The first one was with the doctor on the telephone,
Yeah,
and that was a little sarcastic.
yeah, or something like that.
And
I
then
don't
after
know.
that, you had a talk with this doctor, which you really appreciated.
Yes,
Okay,
same.
I got that one.
That's right. And yeah.
You like this doctor?
Well, when it comes to certain things, he's like, for instance, the subject of this came up, and like I said, yeah, I recorded it, so it's on recording. Which I don't think he was embarrassed by this position whatsoever. For me, if I took this position, I might look back on it with some high level of embarrassment. But when I brought up the subject of diet and how nutrition and even I brought up proteins could directly have an effect on nerve pain, he said, well, there's no real evidence that those are connected. I said, oh really, you've looked into this, or well, in medical school, I just, I'm telling you what I learned, that there's no connection between diet and your level of pain, or those two things. Yeah, exactly. You laugh with embarrassment for the guy, right? And I mean, for me, I at least from my perspective. So then I'm talking with the doctor here, and he was just like talking about conversations he had in Russia about with his colleagues, and also what he would have done in a similar situation. Oh, the whole conversation was very enlightening, let me tell you. But it was like pushing on an 18-wheeler, with your strength. Or maybe you have a buddy helping you, it's not gonna really move it. But no, that's a bad thing to say. I wouldn't say that. He did allow me to send him a video. I'm gonna send him a video. I'm gonna send him a video about that lady that I spoke with, who the doctor, the doctor that was talking about her research into this subject matter.
In Russia, they have a different way of looking at it.
Well, it sounds like he was more open-minded, or maybe it's a product of age, or just where your background. But basically, what we had concluded with some, which that this doctor actually didn't draw any, and we were saying how it's as simple as saying that. You might as well eat at McDonald's or wherever you wanted to every day if diet had no effect on your metabolism and your nervous system. Yeah. And I think he was just being blunt with me that he didn't want to have any part in helping me. Or something, maybe. I hate to draw that conclusion. I can't understand where he was coming from. He was just throwing his hands up. And then when I asked him to confirm that that's what was happening, he confirmed it. Well, I'll take a look at that video, but I can't promise you anything. I don't think that those two are connected. Anyway, I'm gonna put it on YouTube. Let the audience respond. I asked him directly if he reminded it being recorded, and he said no. Monamita did not want anything to happen to that. They didn't want anybody opening it. They didn't want. Oh, we have important visitors.
Hello.
Oh, hi.
Hi.
Hi, Christine.
How are you?
I'm good. Well, I'm doing okay.
Hello. Aww.
He didn't run away. It was like
Very-
he knew that you were okay.
Oh, really?
Yeah, he knew
Yeah.
that.
Yeah, they have a very strong sense of like they can sense, right?
Yeah, before you were even in the door, he didn't run away. It's a angle, yeah.
Really?
Yeah.
Do you sense me? We would like to assess your toxic.
Okay,
But-
let me show you a recent picture from last night.
Yeah, but Sharon told me that if you can stay on your bed so we can do our assessment.
Okay, well, I have to arrange that or schedule that.
What time do you usually up on your chair?
Well, I can delay it a little bit on some days.
Yeah, 'cause I tried calling. I was thinking of visiting you at 10 o'clock, but you're already on your chair.
That's right, that's right.
So do you usually up by 9? 'Cause we cannot do 9 o'clock.
Around
'Cause
then.
by 9 o'clock we just finish, or sometimes we
But
still
I
have
can
our
wait till
huddle.
like 9:30 maybe.
Well, I'm not sure about 9:30. That's way too early because we have to probably 10 o'clock.
Alright, on some days I can do it.
At
I can't
10
promise.
on
but
Sunday?
I'll-
Okay, well,
No, I said on some days.
oh, some days.
Yeah.
Okay, Sundays.
Mondays might be okay, but those days I have somebody who comes later, but I'm even not sure I can schedule her because of the amount of pain that I've been going through. I just got a conversation with my doctor trying to speak with him about it.
Okay.
Really, his best advice was go to the hospital,
Mhm.
which I already considered that multiple times.
Yeah.
Anyway, I'm looking at nutrition.
Okay.
I'm looking at some other things on my own because that's what it's coming down to.
Okay.
Or gone up to, I should say, not
Okay.
because
Yeah, well, just like what I said, we would like to
let
see.
me show you this
Okay.
picture anyway. Please.
Did you send Sharon recent picture of the?
No, not.
No?
Oh, let's do it right now. You can. Yeah, so these are the bandages right now.
Okay.
The skin color is pretty normal. There's a little bit, it's a little bit painful in it. I did change it after this. This was last night. There was no tegaderm.
Why do you have those so much?
There was wrinkles in the sheet.
Okay.
I know. That was, I know my caregiver pointed that out.
Mhm.
I want to show you
your next visit. Maybe you can stay on your bed. Oh, it's just
Oh, I
once
can.
weekly.
I can.
What
Here, look,
what
look,
day
here
we
we go.
usually
There we
visit
go.
to? Is it Tuesday? Every Tuesday?
That's it right there. And keep going back, because you can do it with more reliability.
So this is like on Sunday.
There, that's the tailbone right there.
This is your, I cannot see.
Coccyx, that's
This is your
coccyx.
coccyx. This is,
Yes.
okay. So somewhere here.
Well, yeah, no, in that, where that's where the main wound used to be a long time ago, and then it healed up.
So what do you use?
I don't use anything on that. I
So-
use a little bit of polysporin sometimes.
Just
But
polysporin?
that one's not open. The ones,
Yeah.
can you zoom out again? Zoom out again, sorry.
So when it's open, do they use
Zoom out.
Unidine?
Yes, what, this was most recently, this was the area that was open, and this one a little bit.
Where, here?
No, see that line?
Oh, here?
Yeah, it's all been
Okay.
along the scarring, or right, down here, and that was mostly from bandage edges that
Right.
had rolled up. So that's not happening anymore. I'm very careful.
Okay.
I'm trying to find the one of the other spot. Oh. Yeah, it's practically healed up. That's the other one, that was the concerning one
This
for a
one.
while, yeah.
So now it's like closed now? Or,
Well, you make a judgment, I think
There's
it's
still-
closed.
yeah, it's
I
still,
think it's closed, or very close to closed.
there's no more?
Yeah,
That's
there
it?
are more, no, there you go, keep going. There's one, that's a little blurry, keep going.
Oh,
There,
this
there,
one.
there. Yeah, that's from.
Yeah,
the
it's
previous-
already scarred. When is this? Saturday.
So it looks better than that now,
Okay. And it's keeping dry, right?
yeah.
No drainage?
I'm just using a little bit of polysporin now. I used Inidine till it closed up.
Okay. So
Yeah.
do you use like polysporin every in all areas?
No, just the
Just
one.
that one?
Yeah,
And how about here? What do you use here?
same thing pretty much, sometimes I use only.
And what is this?
Silicone. That's also just protection, it's that line you saw on the side,
Okay.
that
Yeah,
one I
yeah.
showed you.
Okay, so there's
Yeah.
no like open area there,
No,
right?
you saw that, that's what it looks like now.
Okay.
So that's pretty much the state of
Yeah,
things.
like I mean, if you can stay on your bed at least 10.
I
10 to
did,
10:30.
last night I got to bed at, 7 or 8, I was in bed.
No, I mean, next
then I-
visit, on our
Oh, I
next
see. Yeah,
visit,
yeah, yeah,
if you
yeah,
can
I
stay
will.
on bed, like until we assess the area, right?
Yeah.
Because we need to do our measurements, updated photos. Yeah? Please. Do we
Oh, thank
usually
you. No,
come
no,
every
I-
Tuesday or Monday? Because I know yesterday was a stat holiday.
Monday I usually hear from you.
Oh, Monday? Okay.
Why, Tuesday you come in?
Well, today's Tuesday.
Yeah,
Right.
Tuesday, I don't, I hopefully.
How
don't
about
come.
Monday? Does Monday work for you? Like if you can stay a little longer in bed?
Yeah.
Like 10 o'clock? Because I will be putting it on our schedule, like to see you at 10 o'clock, because you're going to be in bed still. That's
yeah,
good?
I can't be any earlier than that, okay. That's
Okay.
fine,
Then how are you going to transfer to a chair? Do you have home support around that time?
yeah, no, I have my own caregiver's gonna be here
Okay.
when you come.
So you're going to be in bed 10. I'm just making sure.
On
Monday.
Monday, or I can do Tuesday as well, but Monday, probably more likely. Yeah, Monday's good.
Monday? Okay. All right. Let's see.
You know if it'll be you? It'll be somebody.
It depends, like, because
Yeah.
even though I put you on my schedule, if you
Somebody
know
else will
somebody
do it.
else who can like reshuffle it, right?
Yeah, yeah.
Yeah. Where are the Inadines?
Oh, and my finger too, you can take a look at it.
Yeah.
It's done, it's healed.
Oh, it's healed already. So you're not putting anything now? Oh yeah, it's scabbed over already.
Now my latest wound is from my friendly kitty.
Kidding.
But, he
Is it
just-
okay?
He saw, he wanted
When
to
was
get-
that?
Yesterday.
Just yesterday? Was it too bad?
It was bleeding a lot, but the caregiver put some.
Okay. Do you want me to
So-
check? Okay.
That's gonna hurt though, my pain level's too high. On my leg, I don't know if I wanna stand it.
So
But
did
yeah,
they
you're
clean it
probably